More than 20 million people worldwide have rheumatoid arthritis right now, and rheumatoid arthritis affects about 1% of the entire US population. But here is what most of those people were never told: rheumatoid arthritis is not arthritis in the traditional sense. It is not wear and tear. It is not aging. It is your own immune system, the system designed to protect you, identifying your joint lining as a foreign enemy and launching a full-scale attack that destroys bone and cartilage from the inside out. And while it is destroying your joints, it is simultaneously attacking your heart, your lungs, your eyes, and your blood vessels. Early detection is crucial because rheumatoid arthritis causes irreversible joint damage, and the window for the most effective treatment intervention is narrow. Today I am going to show you the 7 early warning signs of rheumatoid arthritis that appear long before X-rays show any damage, and the 1 blood test combination that reveals the truth years before a diagnosis is typically made. Sign number 4 happens to millions of people every single morning, and every single one of them has been told it is completely normal. Rheumatoid arthritis is an autoimmune disease, meaning the immune system produces antibodies that attack the synovium, the thin membrane lining your joints. This causes persistent inflammation that thickens the synovial lining, producing enzymes that slowly digest bone and cartilage. Unlike osteoarthritis, which affects joints unevenly based on use and injury, rheumatoid arthritis attacks joints symmetrically, the same joints on both sides of the body simultaneously, and it affects the entire body, not just the joints. Pulmonary manifestations including interstitial lung disease can be seen in up to 30 to 40% of patients with rheumatoid arthritis, recognized as the second most frequent cause of death in RA patients. This is not just a joint disease. This is a systemic disease that happens to start in the joints. Here are the 7 early warning signs your immune system is already attacking your joints. Warning sign number 1: pain, swelling, and tenderness in the small joints of your hands and feet, specifically the knuckles and the joints at the base of your fingers. The first symptoms people often notice are stiffness and pain or tenderness in their joints, with the joints in wrists, hands, fingers, and feet more commonly affected early in the progression of rheumatoid arthritis. This is one of the most distinguishing features of RA. It begins in the small joints first, not the large weight-bearing joints like knees and hips that are typically affected first in osteoarthritis. If you have pain and swelling in your finger knuckles and the joints at the base of your fingers and toes, with no injury to explain it, this pattern demands rheumatological evaluation. Warning sign number 2: the same joints are affected on both sides of your body simultaneously. You wake up and both wrists hurt equally. Both hands are swollen equally. Both feet ache in the same places simultaneously. This bilateral symmetry, both sides of the body affected equally and simultaneously, is one of the defining clinical features of rheumatoid arthritis. Osteoarthritis affects joints unevenly based on which joint was used more or injured. RA attacks both sides at the same time because it is an immune system response, not a mechanical one, and the immune system does not favor one side of the body over the other. Warning sign number 3: joints that are warm and visibly swollen without obvious injury. When the immune system attacks the synovial lining of a joint, it triggers inflammation that causes the joint to become warm to the touch, sometimes noticeably warmer than the surrounding skin, and swollen with excess synovial fluid produced by the inflamed lining. Many patients notice their knuckles are visibly larger than they used to be, or that rings they have worn for years no longer fit because their finger joints have swollen. This warmth and swelling without injury is your immune system actively destroying joint tissue in real time. Warning sign number 4: morning stiffness that lasts more than 1 hour. This is the one that millions of people experience every morning and are told is completely normal aging. It is not. In rheumatoid arthritis, morning stiffness is a central and diagnostic feature. The inflammatory chemicals produced by the immune system accumulate in joint fluid during the hours of sleep and inactivity, reaching their peak concentration by early morning. The result is profound stiffness, sometimes complete inability to make a fist or bend fingers normally, that lasts not minutes but an hour, 2 hours, sometimes the entire morning. The medical guideline for distinguishing inflammatory arthritis from mechanical arthritis is precisely this: morning stiffness lasting more than 1 hour indicates an inflammatory process, not simple wear and tear. Warning sign number 5: fatigue and a general feeling of being unwell that accompanies the joint symptoms. Rheumatoid arthritis is a systemic disease, meaning the immune activation affects the entire body, not just the joints. The inflammatory cytokines circulating throughout the body create a systemic illness response, causing profound fatigue, low-grade fever, loss of appetite, and a general feeling of being unwell that many patients describe as feeling like they have the flu all the time. Most people attribute this systemic fatigue to their joint pain disrupting sleep, when it is actually the immune system's body-wide inflammatory response that is consuming their energy. Warning sign number 6: small, firm lumps under the skin near affected joints. Called rheumatoid nodules, these firm, painless lumps typically form over pressure points, the elbows, knuckles, heels, and back of the head. They range from the size of a pea to the size of a marble. Rheumatoid nodules form when clusters of inflammatory cells accumulate around small blood vessels, and their presence indicates that RA has been active for some time and that the immune system's inflammatory response has become a established throughout the body's tissues. Their appearance typically signals more aggressive disease that requires more aggressive treatment. Warning sign number 7: eye dryness, redness, and sensitivity to light that comes and goes. The immune attack of rheumatoid arthritis is not confined to joints, it frequently targets the eyes, causing a condition called scleritis or uveitis, inflammation of the sclera or the iris of the eye. Patients experience dry, red, painful eyes that are sensitive to light, often dismissed as allergies, screen fatigue, or dry eye syndrome, for months or years before anyone connects the eye symptoms to an underlying autoimmune condition. In severe cases, untreated eye inflammation from RA can lead to permanent vision damage. Now, the blood test combination that catches RA before X-rays show damage. Ask your doctor for two specific tests: rheumatoid factor, called RF, and anti-CCP antibodies, called anticyclic citrullonated peptide antibodies. Laboratory markers including rheumatoid factor and ACPA, anti-citrullonated protein antibodies, are among the most important factors for early detection of rheumatoid arthritis in primary care. Anti-CCP antibodies are particularly powerful. They can appear in the blood up to 10 years before clinical symptoms of RA become obvious, offering a window of early detection that most patients and physicians never take advantage of. A positive anti-CCP combined with morning stiffness lasting more than 1 hour and symmetric small joint involvement is a combination that requires immediate rheumatological referral, regardless of what X-rays show. Early treatment of rheumatoid arthritis, started within the first 3 to 6 months of symptom onset, dramatically reduces joint destruction and improves long-term outcomes. The medications available today, particularly biologic therapies, can achieve remission in many patients when started early. The tragedy of RA is not that it cannot be treated. The tragedy is that most patients wait years for a diagnosis while irreversible joint damage accumulates because nobody recognized the early signs. If this video helped you recognize something you or someone you love has been dismissing as ordinary joint pain, share it right now. Because morning stiffness lasting more than an hour is never just arthritis, and someone in your life may have been told exactly that for years. Subscribe and hit the bell, because in my next video I am going to reveal the disease that is silently destroying your vision from the center outward, affecting millions of Americans over 50, and the shocking fact that most people only discover it when they try to read and realize something has been quietly changing for months.